Hello and welcome. I'm Dr. Adam Dorsay, a psychologist in Silicon Valley and the host of SuperPsyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. SuperPsyched is your tool to get more of what you want in your life and less of what you don't. Narcissism. It's a provocative word. Its definition includes excessive, unhealthy self-interest. But narcissism exists on a spectrum. We actually need a bit of it to engage in self-care. Yet, when there's too much narcissism in the mix, we become self-focused. We can become non-empathic, grandiose, and, in a word, insufferable. Around 2,000 years ago, Hillel the Elder described a balancing act when he offered the following koan-like statement: "If I am not for myself, who will be for me? If I am only for myself, what am I?" Since it's important to understand narcissism, I called on one of the world's leading experts on the topic, Dr. Reid Meloy. Reid is a forensic psychologist, author, professor, and expert called upon by the FBI and top-tier groups all over the globe when they need information about narcissism and personality disorders. This is Reid's second episode on SuperPsyched. In his first, he spoke about the unsettling topic of psychopathy, and his episode was very well received by listeners. I'm confident this episode will be too. So listen in as Reid and I talk about the myths and realities on the subject of narcissism. Dr. Reid Meloy, who has asked me to call him Reid, welcome back to SuperPsyched.
Thanks, Adam. Great to be with you again.
So great to have you back. And it's been far too long as far as I'm concerned. I would like to just say it on the record. I'd like for you to be a repeated guest more than just these twice so far. But the word narcissism, it's omnipresent. And yet it is so misunderstood. Sadly, just to let you know, many of these so-called thought leaders, and they are not thought leaders, are just ordinary people on TikTok standing on a soapbox describing something like narcissism, and the public is taking it hook, line, and sinker. What are some common misconceptions about what narcissism is, and what is it really?
Yeah. Narcissism gets a bad rap, the word itself. And the way I like to frame it is that narcissism is like blood pressure. Too much or too little is the problem. And narcissism, there is such a thing as healthy narcissism.
Yep.
The fact that I got up this morning, took care of my personal hygiene, put on clean clothes, had some breakfast, fed our dogs. I didn't make too much noise to wake up the rest of my family. Those are all aspects of healthy narcissism, is that, in other words, you're taking care of yourself and you're also taking care of the people that you love and the dogs that you love. And we need to account for that. In the pop culture, healthy narcissism, typically the words change. A few years ago, it was resilience. And resilience is healthy narcissism. There was a period of time where grit became very popular to talk about. And grit is about healthy narcissism. And it's our capacity to, in a sense, manage the difficulties of life, the slings and arrows of misfortune, and to be able to get up, start again, take care of ourselves, and take care of those that we love. However, there is also pathological narcissism. And that's where I know the conversation is real important to have. And that can manifest in a number of obvious ways. But the frame for pathological narcissism is there is a level of self-absorption and self-focus that it begins to detract from one's relationships with other people. And as pathological narcissism becomes more severe, you start to see these individuals engage in behavior that is destructive of other people. And then with pathological narcissism, we also can veer off into psychopathic individuals, and we know that the core of psychopathic individuals is a pathological narcissism. However, there's many other aspects that go along with psychopathy. And then there's also something that Otto Kernberg referred to as malignant narcissism. And Kernberg was a very famous psychoanalyst who I greatly admired and learned a lot from. And he talks about malignant narcissism, where it's a combination of this level of very, very intense self-absorption coupled with paranoid view of the world and of other individuals. And that malignant narcissism can also become very dangerous. A great example of this, some of your listeners will remember this case of Jim Jones from Guyana and the fact that he was able to literally develop this cult and have 700 to 800 of his followers all commit suicide together in this remarkable, tragic event. But Jones was likely a malignant narcissist, where he became convinced that there were these imminent existential threats to him and his group. And the best course of action was for them to all commit suicide together. So we see examples of this, of course, that show up in the press. But we are a society that continues, I think, to struggle with pathological narcissism. We see that in our leaders. We see that in certain professions where pathological narcissism, at least to a certain degree, is rewarded. And we also see individuals that struggle with this because it has a huge impact on the quality of their relationships and their ability to maintain any kind of semblance of a loving relationship with another person.
What you just said at the very end, a loving relationship with another person requires, a fancy term is intersubjectivity. That is realizing that you have your subjective experience, I have mine. There may be some confluence between the two, and yet there are two separate individuals having their own subjective experience, which requires empathy. And it's the suppression of empathy, the inability to really lean into empathy, as you said, with the malignant narcissism, the paranoia overriding all else and causing people to behave in ways that will not serve themselves, let alone their pets or the people in their lives. And I love that you describe narcissism as being on a continuum much akin to blood pressure. I think that's a perfect analog. And I find myself thinking about something very important that you came up with or helped really share with the psychology community. And that is that within psychopathy, which is just, one of the darkest of human traits, that there are at least 4 components, one of which is the narcissism. Another one is sociopathy, engaging in antisocial behaviors. Another one can be sadism, and another one is Machiavellianism. But that one of them is narcissism is a key component, in that there is so much kind of a bleed over into darker personality styles. Let's talk about it as we see it in everyday. Let's say we have high blood pressure in the form of narcissism, and we are in a relationship and we want to have a better relationship. What I hear very often is some theme or variation of, well, I'm fine, everybody else sucks. And if they would just understand that I'm great, we'd be fine. What are your thoughts on everyday narcissism? Not the big stuff like the malignant, but just the everyday in common relationships and what can be done?
It's a difficult one to answer. I think that one of the best phrases I ever heard about narcissism is they live in a world of one. And I've worked with lots of individuals that are pathologically narcissistic in all different kinds of contexts over the years. But also I've had a lot of just great discussions with individuals that have attempted to form relationships with individuals that are pathologically narcissistic. And oftentimes the realization for them comes when they suddenly are aware that they have no special individualized value for their partner, and that there are probably hundreds of other people that could just step in and take over their role as a mirror for their partner. Because what the partner hungers for, oftentimes, is just somebody who's willing to reflect back to them their perfected sense of self, reflect back to them how wonderful they are, and also will provide to them both the idealization and the adulation that the narcissist typically hungers for. I use the pronoun he because we know that the majority of individuals that have narcissistic personality disorder are males. There does tend to be a gender component to it, but it's very difficult to have a relationship with a narcissistic individual because there's not that level of what we call reciprocal affectional relatedness, where you can exchange with another person your own feelings, that you have a sense that the other person is actually really listening to you and sees you as a whole, real, and meaningful individual separate from them. And the narcissistic personality cannot do that. There was an old technique that Dr. Kernberg used where he would sit back with a patient and ask them who was the most important other person in their lives. And then the patient would tell him the name. And then Dr. Kernberg would say, okay, I want you to describe this person to me. And I want you to give me a description of their needs, their likes, their desires, their dislikes, what they like for themselves in the future.
I'm already dying here because
I know.
I can just imagine the answer. It's already hilarious.
What they look like, how they feel, just so I can really get a sense of this person as a whole, real, and meaningful individual. And one of his patients sat back and said, she's head over heels in love with me.
Exactly. That is so awesome. Oh
and
my God. That was it. Mic drop. We're done. That is the entirety of this other individual.
Yeah, exactly. And it's really remarkable. But that insight that anybody could substitute for me in this relationship, that I have no particular individualized value for my partner, it can be devastating.
Totally.
For the individual. And it can actually be the decision point where they know they have to get out. Now, in terms of treatment, I want to say a couple things. People with these kinds of narcissistic issues typically benefit from potentially three different things. One is what are called corrective emotional experiences through the years, where they're confronted with this aspect of themselves and they literally begin to consciously work on being more empathetic, listening better, being more responsive, trying to understand how this other person is both like them, but also very different from them, how they think differently, how they feel differently, and really trying to, and having the motivation to really understand them in a sense from the inside out. That's called essentially as you know, a theory of mind, where you develop this capacity to understand the thoughts and feelings and inner life of another person. So that's one way, is through corrective emotional experiences. Usually it takes years. Secondly is through intensive psychotherapy with a really good, typically psychologist or psychiatrist that knows how to work with a narcissistic individual. And thirdly is psychoanalysis, that psychoanalysis, which by definition is typically very, very intense. It's 4 to 5 times a week, and it unfolds over the course of 3 or 4 years. They say that some of the most successful people in the world are narcissistic enough to be able to afford psychoanalysis. So you see, people do benefit greatly from psychoanalysis that are pathologically narcissistic. But all these are very, in a sense, long-term efforts, both consciously as well as unconsciously, because oftentimes the narcissistic individual is defending against many insecurities, many early experiences that induced a lot of suffering, and that all that work needs to be addressed and looked at carefully, and the emotions that are there as a part of that conscious thinking about and working through this old material. So it does take a very long time.
Well, it's so fascinating to hear your renderings, and clearly the result of years of deep thought around this topic and hours of having worked with people with these features. I just think about the ancient Greek idea of Narcissus and his tragic end while he's looking at his reflection in the lake or body of water, whatever it is, and he dies. The opera does not end well for the narcissist. And one of Kernberg's contemporaries, Erich Fromm, has my favorite quote on love of all time, because love, it does turn out, Paul McCartney got it right. This is one of the most important things that we're going to experience in this lifetime. And a crucial aspect of love is the ability to be able to reach out and to feel into another person's experience and have an authentic connection. One of the things that we also know is that on people's deathbeds, what they express regrets over, one of the two big ones is love left on the table. And for the narcissist, I would think that it would be a very hollow victory if they got what they wanted or what they thought they wanted, because actually they didn't get to experience that thing called love. Fromm described it, love is not a feeling, but rather a capacity to override our own narcissistic tendencies and experience another. I'm paraphrasing it horribly, but anybody wants to look up the piece in Google on love from Fromm, it's one of the best I've ever read. I'll probably put it in the show notes, but it is the overriding of our inherent narcissism.
That's very good, Adam. Yeah. And for the listeners, Fromm, I think it's Fromm.
That's right, Erich Fromm, Erich.
And he was also one of the few psychoanalysts during his time that was very much interested in also social psychology and that sort of the engagement with other individuals, which does make him a very important figure, even though a lot of his material, the listener and the reader will be struck by how old it is. But one of my missions is to try to persuade and urge people to be historical, to look at figures from the past, because they have a lot of wisdom that all we need to do is rediscover it. But it was there and it was written about and talked about years ago. And Fromm, I think, is one of those very important figures.
I couldn't agree more. His book, The Art of Loving, you can read it today and it reads just as well today. Holocaust survivor, interestingly. Probably Kernberg was as well, if I'm not mistaken. But
I'm not sure. Historically, I don't know the answer to that question.
But I do know that a lot of them were, and it's just all the more impressive. Obviously, the famous one is the fellow who wrote Man's Search for Meaning, which everybody seems to read these days, Viktor Frankl. So what actually can help? Because, we have so many defenses against our own narcissism. Well, I do this because if I don't do this, then the world will take advantage of me. If I don't do this, blah, 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 or everybody else is screwed up, don't they see me, or blah. There's so many blocks to working with someone who is pathologically narcissistic that it requires their willingness to say, okay, I'm willing to engage. I'm willing to try to soften this. How can that work?
One of the tragedies of the pathologically narcissistic individual, and you kind of alluded to this, Adam, is that they find that they're living life alone as the years go by. And I remember being struck by a study I read years ago that talked about how borderline personalities that are particularly narcissistic, one of the big risks for them is that they would live life alone and that they would never be able to connect with another person. And we see that with the aging narcissistic male is oftentimes they are by themselves. And the tragedy is that oftentimes what comes with that is a deep sense of a loneliness and disconnection with other people. And today we're seeing pathologies that are being, I think, magnified by various occurrence in our culture, such as social media, where individuals living within that loneliness begin to become more blaming and more misanthropic, disregarding, becoming more disgusted with, developing actually deep hatreds for humanity and isolated from that. And I think that can be potentially, particularly in the world that I work in, which is threat assessment and threat management, that can be particularly dangerous, where you see this detachment and then this developing misanthropic attitude of disgust with humanity. But what's hidden there, of course, is the self-loathing, because the narcissist, when he says, I'm disgusted with humanity, who's he talking about? He's also talking about himself and the deep hatreds and the deep self-loathing. So you will see individuals. Now we're seeing this just in the past few years, this has become more evident for those of us in this particular field. Individuals that have developed these misanthropic beliefs have devolved into this state of mind over the course of months, if not several years, and then decide to carry out an attack on other people, oftentimes complete strangers, as a means to end their life and somehow just strike back at a world that has essentially left them behind. But what the narcissist has a terrible time with is taking personal and social agency for and accepting responsibility for what he's doing to and against other people, and recognizing that that's contributing to his sense of isolation and his sense of loneliness. But the narcissistic male at greatest risk is when he hits his 40s, because he starts to become clinically depressed. Why? Because oftentimes his best friend is now the red Porsche sitting in his driveway, but has no other or actually real connections with any. He just has connections with inanimate objects, sort of red Porsche, psychoanalysis, red Porsche, psychoanalysis. I think I'll go with the Porsche for my midlife crisis. So the healthy narcissist, though, will recognize that he's becoming depressed and there are these issues that he needs to work on, and he needs to get help for himself. So depression in a narcissistic male in his 40s and 50s is actually a really good sign if you can push him, nudge him, persuade him to go see, hopefully, a mature psychotherapist or a very mature psychoanalyst that can work with him. So that the depression can actually be a very, very good sign. Where there's no depression, the psychological defenses are so resilient that they're typically impenetrable, and there's probably no hope for this individual addressing their narcissistic issues. And what will happen is they will just lead a life of greater and greater isolation. Now, if you've got a lot of money, then you can make that work for yourself, because you can just buy pleasures, you can buy people. And so you can mask yourself from the actual absence of love that is there. You can mask yourself from it because you're essentially buying people's attention, buying people's affection, buying people for sexual pleasure. And that, of course, can go on for years. So the pathologically narcissistic male with a lot of money has these means of survival that actually can be very effective in our society. But the individuals that have not done well financially oftentimes are faced with these losses to a much, much greater degree.
There's so many wonderful things that you've said, and I just want to reflect on a few. First and foremost, the misanthropic nature of narcissism. Schopenhauer apparently once said, there are two types of people in this world. I recommend that you avoid both of them, which I found really funny. And obviously, like maybe the tattoo of anybody who identifies as a misanthrope. But we know that Barbra Streisand kind of got it right, when she said people who need people are the luckiest people. I would take a blue pen to that and say people who know they need people are the luckiest people. And we
Good.
know that through actually looking at the science of luck, there is a correlation between the number of people you know and your luck. There's no way to passively increase our luck, but knowing, having a large circle increases, there seems to be a correlation. So there is something about our species that made us successful versus the Neanderthals. Partially, some people suggest because we are so pro-social, we are well coordinated. And these are really important things. And I love what you talked about, agency and accepting responsibility. Super important to find a therapist who can not only validate and hang with and get to know you, but also challenge. It seems like the X and Y axis of therapy that we want to have kind of a hockey stick around are challenge and support, or support and challenge. We want to, of course, be supportive, but we need to challenge, especially the narcissist, and ask the old question of how's that working for you? Like, might there be any costs to how you're currently engaging? I would love if you could talk just briefly about these two rather highfalutin terms in simple terms of egodystonic versus egosyntonic, because they relate, I think, very well. And trust me, listener, I know those were big words, but they will make perfect sense in a second.
Well, Adam, before I do that, though, I don't want to lose this thought.
Okay, so please. Important.
And that is, I want to talk about the oftentimes hidden narcissism within the partner of a pathologically narcissistic man. And here's how it's manifest, is that she will be there with him and know that this guy is so self-absorbed and so, I have such a great inability to communicate with him as his partner. And what she's thinking is, I will change him.
Exactly.
And that's the hidden narcissism. And my advice there is get out.
Yep.
Change is in the wind, but it's not changing him. Change your partner. You're going to waste lots of years, and then you're going to reflect back and say, why did I stay with that individual for so long? Why did I think I could possibly change him? So that's such an important thing that I've seen time and time again.
I have to wedge in because this is just too. So we're talking about, obviously, about heteronormative relationships with male and female in this case. This transcends gender, of course. We could be male, male, female, female, and other. But I've definitely seen a lot of men riding in on a white horse, hoping to have a corrective experience by basically changing their mom, by being with this woman and investing years of their lives. And these are years we don't get back. These are opportunity costs.
Yeah.
And I've seen it from all types of representations in dyads where somebody's with a narcissist. So I love that you brought that one in.
Yeah.
That's a big one. And it's very unconscious, as Harville Hendrix will talk about in Imago. It's that old chestnut of the woman who had the alcoholic and abusive father who gets together with, guess who? Her father, essentially, in the form of another man, hoping to have a corrective experience. All right. But that being said.
But I want to, on the egosyntonic, egodystonic, those are very old, important psychoanalytic terms. Origins go back now almost 100 years. But egosyntonic means that it is in whatever the experience, behavior, thoughts, emotions are, that you welcome them and they feel very much a part of who you consciously see yourself as, that you consciously identify and you welcome these thoughts, these feelings, these behaviors. And that's what we consider egosyntonic, that you're very comfortable with that. And the pathologically narcissistic individual may be very egosyntonic with these various characteristics. And that's the guy who says, well, this is your problem, not mine.
Totally.
There are lots of projection where there's attribution to other people. They have the problem. It's not me. Egodystonic is oftentimes a very good indicator that mental health treatment, psychotherapy, psychoanalysis may help. And egodystonic is where you become very uncomfortable with certain thoughts, feelings, behaviors, fantasies, ways in which you're interacting with other individuals, that you can reflect and step back a bit and see, I really don't like myself in these situations. I don't know why I did that. It felt out of character. I don't know why I exploded at my wife. I've got to get help for myself. That's what we call egodystonic, where there's a kind of a dystonia. There's a distressful feeling around certain characteristics because they don't match my conscious image of who I am.
And the reason I bring this up is you mentioned
Sure.
that the depression is the way in.
Yeah.
Loneliness, depression has to be in the egodystonic realm.
Correct.
For somebody to deal with an egosyntonic issue. And
Yep.
they have to be able to connect the two and see, oh, wow, there's a cause and effect here. We've got
Very
just a
good.
couple minutes, and I'm wondering, is there anything I should have asked? How are you going to close this thing, man?
I want to say, because it's an area that I've worked in for many years, let me say a few things about psychopathy and psychopathic personality as a very, very, I mentioned early on in our talking today how the core of that was pathological narcissism, but then there's other characterological aspects that are built onto that. But I think we're living in a time where we are faced with psychopathic personality, which can be very dangerous. I think we're facing that in our political leadership right now in the country. I think we're facing that with other individuals that have spent years exploiting the examples, of course, I'm thinking of right now, and it's a long distance diagnosis, but I think it's probably built on solid ground, is Jeffrey Epstein was likely a psychopathic personality, and the destructiveness of these young girls sexually and exploitation of them. You know, we're facing these aspects of individuals in our society that we need to be very much aware of them. That psychopathic individuals do exist. When they get in positions of power, they can be exceedingly dangerous. Do not assume that psychopathy is somehow a mirage and doesn't actually exist, because it's very real, it's very destructive, and there's no treatment for it. And severely psychopathic individuals can engage in monstrous deeds and have absolutely no sense of guilt or remorse for what they've done to other people, and to sort of hope that somehow they're going to change, or hope that somehow they're going to discover their humanity, is a mirage. That's not going to happen. And what best can happen is that the severely psychopathic individual is kept in a place of segregation from the rest of community. These are the intraspecies predators among us. They are very real. You have to accept that, recognize that they can emerge in your personal life, they can emerge professionally for you, they can emerge in the public domain, and we have to be very clear-eyed in recognizing the threats that they can pose to us as a community, as a country, and also geopolitically.
Wow, Reid, thank you so much. I knew this would be a really great interview, and as always, I can never get enough time with you. Thank you so much for
Thanks,
sharing your
Adam. It's
wisdom.
always a pleasure to be with you. Thank you so much, my friend.
You got it, Bo. This is Dr. Adam Dorsay thanking you for listening to SuperPsyched. If you know anyone who might like it or who might benefit from listening, share it. And if you like the episode, please hit subscribe